Governor Larry Hogan says Maryland is making progress in what he's calling his building blocks for a coronavirus recovery plan, but we're not there yet. There are now almost 15,000 cases of COVID-19 in our state. At least 631 are dead. WJZ is live. Amy Kawada brings us the latest from the governor. Amy.
Good morning, Max. Governor Hogan reopened a hospital in Laurel to accommodate several hundreds of patients. And he also announced an aggressive contact tracing initiative, which would allow us here in the state to track thousands of positive COVID-19 cases. Governor Larry Hogan says this newly renovated Laurel Medical Center has 135 additional beds to treat patients with COVID-19. 35 of those are dedicated to people who need intensive care.
With its rebirth, it is once again going to help us save lives.
It's all part of the governor's hospital surge plan. The state has exceeded the original goal of 6,000 additional beds and now has 6,700. This as Maryland continues to see an upward trajectory in cases. That's why officials say the additional hospital space is crucial.
And so that facility would allow us, the 50,000 plus individuals in Prince George's County who are not insured, would have the opportunity to be screened and tested and treated for this virus.
The state's recovery plan requires 4 main building blocks: expanded testing, increased hospital capacity to handle a surge, more personal protective equipment, and ramping up the state's ability to trace anyone who's been exposed to the virus. The governor announced a partnership with a university-based research firm to quadruple its contact tracing. The information will be monitored on a new platform called COVID Link. And Governor Hogan says on Friday he plans to reveal more information about his recovery plan. He says this is what will ultimately lead us out of this pandemic and back to our everyday lives. Live this morning, I'm Amy Kawada for WJZ.
Hospitals across the state are bracing for a possible surge in patients as testing increases. WJZ is live at MedStar Good Samaritan Hospital. Mike Hsu with how they're all getting ready for this. Mike.
Good morning, Max. Local doctors tell us that they've been training for these situations and feel that they are prepared. But then again, doctors in Italy and New York said the same thing before they were overwhelmed by cases and deaths.
As coronaviruses climb past 14,000 inside hospitals statewide, there is preparation, not panic.
We've had about 4 weeks to prepare.
Governor Hogan says Maryland is making progress statewide, increasing the number of hospital beds, including those in ICU. Because the spike is expected, there are now some 22 surge response tents in place outside Maryland hospitals. The Laurel Hospital has been converted from an outpatient clinic and reopened as a full-fledged hospital. Downtown, the makeshift care center at the convention center has 250 beds with medical staff now on standby.
As we expand our testing capacity outside the walls of the hospital, that will also allow health systems to better prepare the needed resources.
Hospitals statewide are feeling the pressure, but Dr. Stuart Bell at MedStar says the gradual climb in cases here has given them enough time to prepare.
It's enabled us to start developing our plans and putting all of our surge capacity programs and anticipation of that.
This is one of those hospitals with the temporary tents. The cancellation of elective surgery statewide has given hospitals capacity once the surge hits. I'm Mike Hsu reporting live in North Baltimore for WJZ.
A second testing site may open in Baltimore County. Officials are reviewing potential options along the Liberty Road corridor. They're hoping to have more information in the next few days. The county's first testing site opened at the state fairgrounds in Timonium. Here in the United States, the number of deaths is more than 46,000, with more than 840,000 confirmed cases. Now, as the spread slows down, some southern governors are loosening restrictions. Governors of southern states like Georgia and Tennessee, South Carolina, Oklahoma, they plan to reopen non-essential businesses in the coming days. In Michigan and New York, governors say it's not yet time to relax social distancing, fearing a new surge in cases.
When we do start to re-engage, it will have to be very thoughtful and precise, mitigating risk to all and mitigating the risk of a second wave.
We can't make a bad decision. Frankly, this is no time to act stupidly.
The daily fight for life is waged at ERs and ICUs across the nation. The doctor working at St. Joseph's Medical Center in New York says he pronounced 6 people dead in a single shift. The hospital says more than 100 staff members have tested positive for the virus. Masks are mandatory when riding on public transportation, but now there's some extra protection on Annapolis city buses. Officials have started installing sneeze guards. The plexiglass will separate the bus driver from passengers, and right now Annapolis buses are only serving patients who need to get to the doctor and essential workers. All Marylanders must also wear face coverings when in stores, but already they're a part of our everyday routine. Sean Stryker explains why wearing a mask can stop the virus from spreading.
Whether they're medical grade or homemade, face masks are the new norm.
Just took some hair scrunchies and a bandana and sewed it together and made my mask.
It's not whether you agree or not, it's what's good for the public.
This video from the New England Journal of Medicine shows how a mask can slow the spread of coronavirus. On the left, lasers capture images of spit droplets from someone talking without a mask. On the right, someone with a mask.
Stay healthy.
These droplets can carry the virus. The less that escape the mask and the less they travel, the better.
Even if it's not very good at stopping the droplets, at least it will have some effect on slowing down the puff of air that would carry them.
Dr. Donald Milton, a professor of environmental health at the University of Maryland School of Public Health, says even with face coverings, it's important to practice social distancing.
There's no sharp line. At 7 feet, you're safe. At 5 feet, you're at risk. No, it's not like that. It's, it gets better the farther away you are.
Also important to make sure the space you're in has good air circulation.
Because then distance almost doesn't matter, because what you're putting into the air will just build up and begin to fill up the whole space.
Dr. Milton says face masks, distance, and ventilation will be essential for keeping people safe as we work to regain some form of normalcy. Now, we asked Dr. Milton how long we should expect to wear these face masks. He said, you better get used to it. Sean Stryker for WJZ.
Okay, a little bit longer before music is played again at the Meyerhoff. That's because the BSO has now canceled all performances through mid-June. This affects 14 more of the orchestra's scheduled performances. Events were previously canceled through May 24th. Ticket holders will be contacted with more information. You can still enjoy the BSO from the comfort of your home. Musicians have been performing on social media as part of the BSO offstage. WJZ has everything you need to know. Just go to WJZ.com and click on Top Stories for a list of resources. You can find the most important links and numbers under Quick Links.